Hi, everyone. My name is Nicole Jorwic, the Senior Director of Public Policy for the ARC of the United States. I'm glad to be here again to give a little bit of an update on what we're hearing and what is going on in the face of the COVID-19 pandemic when it comes to people with disabilities, their families, providers, and the workforce. As I've discussed, we have had 3 legislative packages that have passed in the face of the pandemic. Package 4 is on its way, and I will be discussing our ask for Package 4 a little bit later. But there have been some developments about a different package that is being considered an emergency legislative interim package. In a written statement, Senate Majority Leader McConnell indicated that he planned to work with Senate Secretary of the Treasury Mnuchin and Minority Leader Schumer to get an additional $250 billion in additional funding for the small business loans that were part of the third package. This is because the loans are going out the door so fast and they're seeing that they need to have additional funds there for folks, including service providers and other nonprofits that are applying for these dollars. However, we know this morning, that's today, Wednesday, Speaker Pelosi and Leader Schumer countered back. They, of course, are supportive of the additional assistance for small businesses. They countered and asked that half of that amount be geared specifically towards minority-owned businesses. They also included additional $250 billion for $100 billion for hospitals, community health centers, and health systems. We're not sure exactly what that would include. We would obviously be fighting hard if there were additional funds to make sure that the disability workforce and service providers and home and community-based services might have access to those funds. An additional $150 billion to state and local governments to manage the crisis. This is in addition to the funds that were already part of Package 3. So again, this is not instead of Package 4, it is in addition to. Once again, the package is considered an interim emergency legislation. Also, something you might hear about that was introduced is something that Senate Democrats proposed that's called the HERO Fund. The fund would contain 2 major components: a $25,000 premium pay increase to essential workers. It is our understanding that that would include the direct support professional and home health workforce, and a $15,000 essential worker recruitment incentive to attract and secure the workforce needed to fight this public health crisis. And again, that would include direct support professionals, home health aides, and personal care attendants. We were glad to know that direct support professionals were going to be included in this HERO Fund. However, I really want to clarify that while we like this concept, we do not believe that at this point it has political legs. We know that the House is the body of Congress that is drafting Package 4, and so it was introduced in the Senate, so it's in the wrong House, and it's also partisan. It's only Democrats. So while it is something that we would support in theory, I just want to make sure that it's flagged in case folks hear about it, but we do not anticipate that it is going to move. So now on to Package 4. We have real concerns as a disability community because some people with disabilities have other underlying conditions, and we have even seen a cause for concern around people with disabilities being discriminated against with care rationing. There can be no question about the value of a disabled life. There is also a high risk for people with disabilities ending up stuck in nursing homes and other congregate settings if the funding for home and community-based services is not provided in the face of this pandemic. So what can you do? First, you need to know what our asks are for Package 4. We have a lot of different priorities, but our biggest asks for Package 4 are funding for a Medicaid grant program. So this was something that we've asked for since Package 3. It would support access to home and community-based services. It would support the direct support professional, home health, and personal care attendant workforce. And we know that Congress must act to ensure that folks have access to those home and community-based services, especially because we want to make sure folks aren't getting stuck in congregate settings that are proving to be very dangerous. And the second ask is around personal protective equipment, or PPE. Direct support professionals need to be seen as what they are, an essential workforce, so that they have access to the personal protective equipment and medical supplies that they need to keep themselves and the individuals with disabilities that they serve safe. We need to ensure paid leave for caregivers. As more people with disabilities lose their sources of care, family caregivers are scrambling to provide the supports that their family members with disabilities needs. And while there have been some provisions, some guidance from the Department of Labor that has provided some clarification that parents, for example, might qualify for some of the paid leave provisions in the first packages. At the ARC and generally as a community, we need to ensure that the definition of caregiver is broad enough to include siblings and other family members that might need to step in to provide those supports and services for their family member with a disability. The fourth is help for people on supplemental security income or SSI to access those recovery rebates. People on Social Security Disability Insurance or SSDI, the Department of Treasury did issue clarification that they would not need to file taxes to access those recovery rebates. But unfortunately, up until right now, it's still while the Department of Treasury has provided clarification that individuals on supplemental on Social Security Disability Insurance will not need to file taxes, we still need that same clarification for individuals on supplemental security income or SSI. This is a really simple fix, and Congress must tell federal agencies to use their existing authority to share data for people on SSI so that they do not need to go through the undue burden of filing taxes. So what can you do? Here are some additional details about advocacy steps that we're hoping that folks will join in on taking over the next several weeks to show that as a community, #we are essential. So we have some weeks of action. Congress is on recess until April 20th, and when they return, we will be working on drafting the next COVID-19 legislative package or package 4. This means that right now they aren't in the Capitol, but they're home in district. Or in their states. They will be back in DC on Monday, April 20th. And to ensure that the disability community asks for the 4th package are clear, we have assigned each week upcoming, including this week, a particular focus. So the focus this week is on those home and community-based services that I talked about. The home and community-based service grant program, the Medicaid grant program that we need to ensure that individuals with disabilities have access to the HCBS, and the workforce, the direct support professional workforce, has the pay that they need in order to continue to provide the valuable services that they do and are protected in instances when they can't. Next week is a week of action around paid leave for caregivers. So again, as folks lose their source of supports and services, we need to make sure that care is there. The following week, the week of April 20th, is around access to personal protective equipment, or that PPE, and other medication and medical supplies that individuals with disabilities need. And the last week in April, the week of April 27th, will be to focus on that Social Security, the individuals on SSI access to recovery rebates. So what we need you to do is Congress needs to hear from you. Your representatives, your senators need to hear from you. They need to know why these issues are important and why people with disabilities and their families and the workforce should not be left behind in the next package. If you're comfortable on Twitter, tweet your representatives, or film a video, tweet that video, send that video to the email address for your legislators. There will be a new video that I filmed about the real concerns that we have about people with disabilities ending up in institutions that you'll see tomorrow. Write your representative. The ARC has an action alert that you can use to email your legislators or call your legislators. And always remember to use the hashtag if you're putting it on Facebook or on Twitter, #WeAreEssential. We must come together to show that we as people with disabilities, families, service providers, and workforce are essential in order to make sure that what we need to see in package 4 is passed, so that people with disabilities have the supports and services that they need to stay safe, and most importantly, to live the lives that they choose.